Morning and welcome to Subcommittee 1 Health and Environmental Affairs. We're here for our subcommittee hearing. We ask all participants to please mute their microphones unless they are going to speak at that particular time. Once you're called on as a speaker, we will ask you to mute your online stream before you start to speak. Unmute. So we are here. We have President Mr. Bustos, Ms. Matthews, and Ms. Brawley here. Thank you guys for joining us this morning. We have several bills on our committee, on our agenda actually. We have S508, H4600, H4599, and H4597. And first on our agenda, we have S508, which is a bill by Senator Katrina Shealy, Hutto, and oh, no, you're fine. So with S508, this bill will allow emergency medical services EMS technicians to honor a pediatric do not resuscitate order for a child with a terminal illness. These orders are written at the request of the child's parent or legal guardian after extensive consultation with the child's physician. DNR orders allow for comfort care, i.e. pain control and breathing support, but do not allow for painful and medical futile resuscitative efforts such as electric shocks to the heart or intubation. Even though DNR orders for children are legally honored in healthcare facilities, the current EMS law does not allow a DNR for EMS order for a child under the age of 18. And this bill will allow for that. We have several folks, that was just a brief summary, but we do have a few people who would like to testify on S508. I see Dr. Ridgway is here. Thank you, Dr. Ridgway, our former colleague here and our former chief medical correspondent. It is such a pleasure to see you. Thank you for joining us. We have one folks for S508 and that's present, and then we have a few folks present by Windows Teams: Kathy Stevens, Dr. Conrad Williams, Dr. John Ropp, and Kathleen Lindell. So let's start here with Dr. Ridgway, since you traveled all the way from Clarendon County, right? Is that correct? Yes, sir. And you can, if you're prepared to come forward, would you like to come forward now, or you want to wait? Okay. All right, we'll have Dr. Ridgway come forward and testify on S508.
Thank you, Chairman Hart and members of the committee. I appreciate you guys allowing me to speak. I'll be brief because I think the other members here that want to testify are much more versed in this than I am. I do want to say that I support this bill, and that right now EMS, when they get to a situation, they have their hands tied sometimes, and it makes it a very difficult situation for them as well as for the family. This bill allows EMS to join all the other healthcare providers and institutions in this state to honor the wishes of the patients and families at a pivotal time in their life. This bill also has many safeguards to ensure that at any point and by any means the DNR can be revoked. I just want to say that I am glad to stand here and support this, especially from the EMS standpoint. And if there are any questions for me, I'll be glad to answer them, but I'm going to yield to these in the essence of brevity. I'm going to yield to the rest of the people.
Do we have any questions for Dr. Ridgway? Any questions? I would like to say, Dr. Ridgway, thank you for traveling up here today for this testimony. And I believe you serve in a unique role, a dual role as a first responder and also as the emergency room physician. Is that correct?
Yes, well, I work in urgent care.
Urgent care, okay.
And I serve as the medical director for Clarendon Fire and Rescue for their EMS portion. So,
okay, gotcha.
Yeah, so we see this from time to time.
So this is, you're very familiar with this particular situation?
Yes, sir.
Okay.
And can I say it's very nice to see you guys?
Oh, yeah.
I missed all of y'all, so appreciate y'all putting up with me.
Yes, sir. Yes, ma'am.
Good to see you, Dr. Ridgway. Thanks, Mr. Chairman. Good to see you, Dr. Ridgway.
Thank you.
The only question that I have, and I didn't see it, but I might have missed it because there is a lot of language. If you have a custody arrangement that is shared, can either parent pull it back, or what happens when they disagree?
I believe that if there's a disagreement amongst the parents, that it's null and void. It's pretty. Everybody has to be on the same page, and anybody can drop off of that page at any time. So even just by orally saying, we don't want to honor this, we want everything done. So, and I think there's a provision in there that if both parents or guardians or people can't be, there has to be a time you have to be able to look for them, try to find them, to get everybody on board when it comes time to sign a DNR. So I think the bill has all that in there, if I'm not mistaken. Okay, all right.
Any other questions for Dr. Ridgway? Thank you, sir. It is always a pleasure to see you.
Thank you. I appreciate it.
Thank you. Yes, sir. Okay, next we have for S508, we have Kathy. We're just going to go down the line as they're signed up. We have Kathy Stevens by Windows. Is Kathy Stevens here? Okay. Ms. Stevens, if you could unmute your microphone for us, please.
Okay.
Yes, we can hear you now.
Am I good?
Okay.
Okay, great. Thank you so much for having me, and I am here today to speak in support of the passage of the bill. Is that echo on my end by chance? Okay, sorry. Can I get a thumbs up that you can hear me?
Okay, Ms. Stevens,
Yeah,
I'm sorry.
okay.
If you could mute your live stream.
I'm sorry, I didn't think I had the live stream up.
Okay.
Let me look. I really apologize. Do you want to go to somebody else and come back to me and I'll figure that out?
I mean, you're fine. It's I think I think we can go forward. If you want to go forward, I think we can.
No, that's okay. I'll go ahead. I don't see the live stream open on here, so I'm just going to go for it.
Okay. All right.
So I just want to say that, and I'll try to be brief. I don't take this bill lightly at all, and it's actually something that is very difficult to talk about. And I just want to set a little bit of context. 12 years ago, my husband Eric and I had a daughter named Hallie. She'll be 12 next week, and she came into the world 18 months after her older brother, and she's just so incredibly loved. I wish you could all meet her. It was at her 2-month well child checkup that we started to notice that she wasn't really developing. So she wasn't making eye contact, and she wasn't able to hold her head up. And when she was 9 weeks old, she had her very first EEG, which is a scan of the brain to look for seizure activity. And we learned at that time that she was having near constant seizure activity. And that really began a months and even years long process of trying to get to a diagnosis. And ultimately what we learned is that she has such a rare genetic disorder that it doesn't even actually have a name. There are only 22 or 23 people in the world who are known to have what she has. She is absolutely the most precious child in the world, and we're grateful all the time to get to love her and take care of her. Heartbreakingly, truly heartbreakingly, her life is not without pain and challenges. She suffers from terrible seizures that are really hard on her. She's not able to walk and she's not able to talk. And she even has a difficult time forming memories and communicating. She has poor muscle tone, her lungs are weak, and her heart struggles to keep a steady rhythm. She also has a poor immune system. And when I say all of that, I think sometimes that conjures a certain picture in people's minds. So I was just going to quickly hold up this picture. If you can see Hallie in the middle there, she's just this little angel. That's with her two brothers and her cousins. We have two typical sons, Anders and Evan, who are ages 13 and 7, and they, of course, adore their sister, and we're so thankful for that. We would do absolutely anything to help Hallie have her best life. In fact, and I know this sounds a little like bragging, but I just want everyone to know that we've done everything imaginable for her. She has a pediatrician, a cardiologist, a geneticist, a pulmonologist, a sleep specialist, a dietitian, an ophthalmologist, a physical therapist, an occupational therapist, a homebound school teacher, in-home caregivers, and orthopedic doctors, most of those through Prisma Health, who's been absolutely tremendous to us, along with MUSC. We also have palliative care as of the past couple of years, and that's to ensure her comfort. It's not hospice, but really just a comfort voice that's woven throughout all we do, because we just recognize that the worst thing for her is to suffer and to have pain. We would do anything to help her. In our home, we have kind of a proxy hospital. We have oxygen, a suctioner, a CPAP machine, a pulse oximeter, a nebulizer, like a chest vest for breaking down congestion, and a cough assist machine. In her lifetime, her dad and I have called 911 more times than we would ever want to, at least 6 or 7 to my knowledge. We've called for really bad seizures when she has stopped breathing and when her oxygen is really low. 3 summers ago, while we were vacationing in Hilton Head, Hallie had the worst seizure of her life, and she had to have bag breathing for an hour. Her oxygen was in the low 40s, and she was airlifted to MUSC to be intubated, which thankfully never happened because of some very quick work to put her on high flow oxygen by the amazing physicians at MUSC. We truly thought, we thought we had lost her. We thought she passed away in the condo at the beach. And the EMS guys who were there were just remarkable, and they had us tell her goodbye as she went away to the helicopter. It's such a scary experience. It's really hard to put into words, but that experience did lead us to having some important end of life conversations about Hallie. And we should have had them before, but they had not come up. And this situation led us to really have those conversations with our physicians. We had a DNR on file at the hospital up here in Greenville at Prisma, but we didn't have a copy with us at the beach. And through that process, we learned that by law, EMS is required to undertake all life-saving measures, even if it goes against the parents' wishes. And so this is, of course, very difficult to discuss. Our palliative care doctor and nurses began to walk us through what life-saving measures look like. And I'm going to say some things that are hard. It's not just like ER or primetime TV, but what does it really look like in reality? Shocking Hallie's heart, which we would not want to have done, but would be done, is dramatic and intense and painful. To truly begin pumping a heart that has stopped, one has to break the breastbone through force. And intubation can lead to a long time on a ventilator. And all of these things would increase the risk of infection for Hallie, and she struggles with that. So once we came to understand these scenarios, and I'm almost finished, I promise, we now keep a DNR with us for Hallie in the car, at home, and at home. And I can't emphasize this enough. The very last thing that we want on this earth is for Hallie to die. It's going to absolutely crush us. We love her so much that it hurts. However, if the time comes that she does pass away, we want that to be as pain-free and comfortable for her as possible. And we do believe that after all this time with her, that we as parents know what's best for her and should have the right to make the best informed medical decisions on her behalf. We want EMS to be able to honor our DNR And we don't want to have any fear of calling EMS in the middle of a crisis and in case things do go the wrong direction and they undertake measures that we do not wish for Hallie. By passing this bill, I promise you that you'll be ensuring comfort for our most fragile children when they are experiencing their hardest days. Thank you, and I would be happy to answer any questions.
Thank you, Ms. Stevens. Any members do have any questions for Ms. Stevens? No questions? Thank you, Ms. Stevens. You have anything else you would like to add?
I don't think so.
Okay, thank you very much for your time and participating. This is a very important process, and we're glad you're here to participate.
Thank you for having me.
Yes, ma'am. Okay, next is Dr. Conrad Williams here.
Yes, I am.
Okay, Dr.
coming in,
Williams, you're next.
All right. Well, thank you to the members of the subcommittee. My name is Dr. Conrad Williams. I currently serve as the medical director for the palliative care program at the Medical University of South Carolina. I'm also a certified hospice medical director and provide home hospice support for children here in our state. Thank you for this opportunity to speak in support of passing Bill S.508. I don't know that I have much to add to what Ms. Stevens just shared, but I can provide kind of the medical background to this bill. So as we mentioned, it does grant parents or legal guardians the right to make decisions for their child through the time of death, if that happens for a child who has a terminal condition. And so I think it's really important that we're able to allow parents to continue to make those decisions, even in really excruciating times. And it also allows, as we mentioned, our EMS professionals, first responders out in the field, just provides them more clarity as to their role. The perspective I think outside of my comments that may be helpful is that a DNR order or a do not resuscitate order really only speaks to what interventions might be performed when a patient, and in this case a child with a terminal medical condition, their heart or lungs have stopped working pretty much totally. And so they are really in a process of what we call actively dying. And so there are things that we can do, such as chest compressions and some other interventions that is an attempt to really bring that person back to a stable living state. And there are certain medical conditions in which really doing those interventions just aren't medically recommended. And sometimes in combination with that medical recommendation, families also feel like those types of interventions would just be too much for their child. And so, I often have conversations in a hospital setting with families around these types of questions. And so again, this would allow us to honor those wishes and those medical recommendations in a home setting as well. And to be very clear, having a DNR order in place does not in any way restrict that child's ability to receive care in a hospital setting or in a clinic or anywhere else. And also, there is language in the bill that specifically states that when there are two people, typically a mother and a father, involved in the decision-making and the legal guardianship for that child, then this conversation does have to happen with those two parents or those two legal guardians. And such an order is not put in place if one of the parents is in disagreement. And then the other thing I would add is that, as Ms. Stevens kind of referenced, this order can be revoked at any time by a verbal statement. If EMS shows up and family says, we have this order, but we want to be clear that this is no longer applicable, then they just simply need to make that statement. And so I hope that was some helpful kind of medical, contextual background. I'm happy to answer any questions that you may have. I appreciate the time to talk in support of this bill.
Do we have any questions from any members of the committee for Dr. Conrad Williams? Yes, ma'am. Ms. Brawley?
Thank you, Mr. Chairman. I'm not sure if this question is actually for you. It's more of a question about the bill itself, but maybe you can help me with it. So if one of the parents decides, or let's say a situation occurs and a parent is there, there is a DNR for that child signed by both parents, and it can be, as you say, revoked at any time. That parent who's present is comfortable with that DNR. If the other parent, can the other parent challenge that DNR at that moment or beyond that moment legally if the DNR was signed by both?
So, so a good question. I think in the moment, so in the setting of when somebody is actively dying, there's not an opportunity to really challenge legally that process, because really this is kind of a process that happens in a matter of seconds or minutes, if that makes sense. And so if there's, you know, any disagreement in the home, then the default, if you will, is for EMS to perform a full resuscitation, to transport that child to the nearest hospital as soon as possible. If you're asking more about kind of, because a lot of times we have these conversations, as Ms. Stevens shared, way ahead of the time in which a child might be at end of life, if they even get to that point. And so if in the process of having that conversation there's disagreement, then what happens is that I have yet to be in a place where it's gone into the courts to settle the decision, because we have a conversation, and if one parent is not okay with it, well, then that's where the conversation ends, and the goals of a full resuscitation remain in place. Oftentimes that leads to a really difficult, but in some ways kind of meaningful, and I would even say beautiful conversation between those parents or the legal guardians about what is in that child's best interest, with the assistance of their medical professionals. And so they come to an agreement one way or the other. So I don't know if that answered your question or not, but please let me know if I can clarify if not.
I think it does in some part, because I know both parents have to be present and agree if there are two parents involved at the point that the DNR is executed. But if both parents are not present when the child starts experiencing a loss of life, then the DNR controls as long as that parent that's there still wants it, right? Is that
Correct.
right?
Yes. In that situation, yes.
Any other questions for Dr. Williams? No other questions? That's it. Dr. Williams, you have anything else you would like to add for us?
I don't. Thank you very much.
Okay, thank you for your time, and thank you for participating.
Yeah, you're welcome.
All right, next we have Dr., and tell me, am I pronouncing this right? Ropp? Is it Ropp? Ropp?
It's Ropp.
Ropp, okay. Dr. Ropp, you're next.
Thank you. Representative Hart and committee, thank you so much for allowing us to testify on this bill. I'm John Ropp, family physician in Hartsville, and I'm also president of the South Carolina Medical Association. So I'm speaking on behalf of the Medical Association in support of this bill. And also I'm a medical services director for Agape Care, which includes Hands of Hope, which is the dedicated home-based palliative program for pediatrics and hospice care. So the Medical Association spoke in favor of this bill last year when it was in the Senate, and we testified, and I'm glad to see that it's now here in the House Committee. We again support this bill as it reads at this time, and I'm very supportive of it. You've heard now from a parent, Ms. Stevens, and her testimony last year was also very moving. So thank you for sharing again today. And Dr. Williams has been instrumental in continuing to progress this bill along. So Dr. Williams, thank you as well. And to the committee members who have taken this up seriously. This is an issue that pulls at all of our heartstrings. Most of us will never experience anything close to what the Stevens family has and so many other families. But there's a lot of clinicians, physicians, other healthcare providers, families across the state, citizens, friends who will deal with this. And this bill makes a lot of sense. It's come a long way, and it's time for it. So the Medical Association stands in favor of this, as do the other physicians in the state, and all of our hospice and palliative programs as well. So again, we stand in support of this bill and hope that it will move forward. Certainly open to any questions at this time.
Any questions for Dr. Ropp from members of the committee? No questions? Okay. Thank you for participating, Dr. Ropp.
Thank you.
And next we have Kathleen Lindell. Are you with us? She's not. She's not here. Okay. It looks like Kathleen Lindell is not present. Oh, yes, you're absolutely correct. Let me get to that. Members, you should have some written testimony from, she's actually Dr. Lindell. She's a doctor and registered nurse. And we have her written testimony here that we would like to submit on her behalf. And she's asking on behalf of the South Carolina Pediatric and palliative hospice condition. She's writing in support of the proposed bill for an at-home DNR and do not resuscitate, allow natural death physician order for people under the age 18. So she is in support. You have the letter, and anyone else who would like to see her letter here, you're more than welcome to. And she says, at the end of her letter, thank you very much for your consideration of and support of South Carolina families caring for children with serious illness. Is there anyone who have any questions or comment in reference to Dr. Lindell's letter? No questions or comments. We also have a letter from Ms. Maggie Cash. Is Maggie Cash here, or she just submitted a letter? She's from the Children's Hospital Collaborative. And Ms. Cash, I am writing today on behalf of South Carolina Children's Hospital Collaborative, the State Children's Hospital Association. She says, in closing, we respectfully ask for support of S508 legislation to allow emergency medical service personnel to honor a pediatric DNR order. So she is also asking us to support S508, Ms. Cash. Anybody have any questions or comments on the letter from Ms. Cash? No comments? All right. Seeing none, it looks like at this time, is there a motion to move and properly second that we pass favorably to the full committee S508? If the clerk will call the roll, please.
Ms. Brawley?
Aye.
Mr. Bustos?
Aye.
Mr. Hart?
Aye.
Ms. Matthews? All right, 4-0. This moves to the full committee.
Thank everyone for your participation. It has passed to the full committee, and we will have a hearing on that shortly also. Thank you. Next on our agenda, we have H4600, which is a bill by Representative West and Representative Bennett. And currently, it looks like we have one person present to testify on behalf of 4600. The purpose of the Adult Health Care Consent Act is to ensure that the patient's wishes concerning medical treatment are honored whenever possible when the patient is unable to consent. The act provides a list of persons on priority who may make these health decisions. The prior list was last amended in 2019. The bill amends the statutory chapter that establishes the right of mental health patients. It revises the list of persons of priority who may make healthcare decisions for a mental health patient in need of electroconvulsive therapy or major medical treatment if the patient is determined by a physician to be unable to consent. The list was revised to be, or is revised to be consistent with the list in the Adult Health Care Consent Act. I remember. Okay, yeah, I thought I remember us doing this. Is Rochelle Canton here? Okay.
Good morning, everybody. My name is Rochelle Caton. I'm the the director of patient advocacy at the Department of Mental Health, as well as the legislative liaison. That bill, the other one was so hard. I'll make this easy. The only thing that this law does is to take our statute, which deals specifically about patient rights in facilities, and ensure that it conforms with the statute that y'all passed in 2019. It does not change anything about how we provide mental health care. It is just making it conform to the change in the law for getting a substitute decision maker when a person is unable to consent on their own. And I'm available to answer any questions.
Any questions from any members of the committee? No questions. Do I hear
Ms. Brawley?
Aye.
Mr. Bustos?
Aye.
Mr. Hart? Ms. Matthews? This one also moves forward 4-0.
H 4600 has been passed favorably to the full committee. Next on our agenda, we have H 4599.
Remind you about our conversation last week about this bill. Ms. Johnson would like you to adjourn debate on
Well, she would.
Yes, sir.
Okay.
Motion to adjourn debate.
Moved and properly second that we adjourn debate on H 4599, bill by Representative Johnson. If the clerk will call the roll.
Ms. Brawley?
Aye.
Mr. Bustos?
Aye.
Mr. Hart?
Aye.
And Mr. Matthews? Ms. Matthews, I'm sorry. Thank you.
Next on our agenda, we have H 4597, which is a bill by Representative Bustos. Representative Bustos is present. This bill seeks to prevent discrimination against a person with a disability for the purpose of organ transplantation. The bill provides that a covered entity, healthcare provider, or facility or organ tissue bank may not, solely because of an individual's disability, and it has the list of the 1 through 6, refuse insurance coverage for any procedure associated with being evaluated or receiving an anatomical gift or organ. And Representative Bustos, would you like to present your bill, sir?
I would.
Okay.
Thank you very much, Chairman. This is a bill, I'm sorry, I'm struggling a little bit with this mask. I think my ears are too close or too far or something. But at any rate, I received a compelling call from a lady who has a child with Down syndrome, which, her fear, as was expressed to me, was that this child would grow up and perhaps be in an accident and need an organ, but not be able to receive it because the doctor decided not to recommend the child be put on a list because of the Down syndrome. As we know, in this age of medical miracles, seemingly, that many people can grow, stay alive, and live very productive lives. And this concerned her so much that she did some research on it and found that South Carolina was one of the states that seemingly allowed this type of discrimination for people receiving anatomical gifts, and that there are other states that did have a law like this. And I think it's like 14 or 15 states that does have a law like this in place. And I looked at it, read, and did a little research myself and found that it's not very often, but there are times when it's recommended that a seemingly, as we say, good organ is not given or allowed to be implanted in a child who has Down syndrome or one thing or another. And as we know, people can grow to have very useful and productive lives. And this seemed to me to be a reasonable request that they should be able to receive these type of anatomical gifts, whether they are they have these disabilities or not terminal, but just disabilities. So I submitted this bill, and I feel that it's worthwhile, and I can certainly answer any questions based on the reading I've done, and also and the parent who called me, their child was exposed to COVID, so she didn't want to come up here, and she didn't want to go on Zoom because she is taking care of a child. So if I can answer any questions, I'd be glad to do that.
Yes, ma'am, Ms. Brawley.
Thank you, Mr. Chairman, and thank you, Representative Bustos, for taking my question and for the bill. You don't think about this kind of stuff until something happens and someone brings it to your attention. I can't even imagine having a child with Down syndrome needing a transplant and being denied the transplant only because of the Down syndrome, which prompts me to this question. Are we talking about disabilities like Down syndrome? Because we know that doctors for transplant organs make decisions all the time about who would be worthy, more or less, to receive the organ because they
Correct.
might be a smoker, they might already be terminally ill with something else. Is this just for people who have disabilities, this bill?
This particular bill is for people who have disabilities, and I just used Down syndrome because that was the example that I had. But certainly, you know, our minds, we see every day people with disabilities, physical disabilities, perhaps blindness is a disability, but that shouldn't make them unworthy of an anatomical gift to continue their life. And you're right, I had not thought of it and would not have thought of it had this lady not called and said, you know, I'm concerned about my child, and I've discovered that South Carolina doesn't have a law like this. And she said, my fear is that, you know, if the child was in an accident and needed I don't know, an organ implanted, that would be denied because of their disability, sorry, their disability because of something like Down syndrome. And I did some reading, and there are and have been cases where, and doctors do some miraculous things, but they can also, in their judgment, say, well, I think there may be a better recipient than someone with disabilities. And of course, I think every life has worth, and, you know, some people grow out of their disabilities, or who knows, in 10 years, medical science may be able to repair some of these things, such as blindness or being deaf or having Downs, so Down syndrome. So that's why I thought it was a good law to have in South Carolina. And we're not breaking ground in this. Other states have it as well.
Listen, I support the bill. I just wanted to make sure when we talk about disabilities, the ones that you've named, I can't even imagine someone not being eligible to get an organ transplant because of that. But I think for that reason, to make sure that it's codified, this is a good bill. I just don't want to prevent doctors from being able to make other medical decisions about whether or not people move up or down the list for organ transplants, because they do make those decisions based upon whether or not someone might have some other kind of terminal illness or potentially terminal illness. But this, you're saying, is just for disabled
The
individuals.
disability, you know, if they find that there's disability and some other thing that no matter, even with the anatomical gift, that they will not survive, certainly that plays into it, and that does not change this.
Thank you so much.
Yes, ma'am.
Yes, and thank you, Ms. Brawley. I'm glad you mentioned that. It looks like, I think you were asking if there was specific disability. It looks like it said, the builder's reading, a mental, physical disability. So it could be mental and physical. And it's talking about under the ADA Act of 1990, saying that those persons are covered, even though they're covered, discrimination is still occurring. So it looks like the bill will correct that to say, look, even though these folks are covered under the ADA, discrimination is still occurring even for mental and physical disabilities. So it's some, thank you, I appreciate you doing this, Mr. Bustos. It is very important. Any other questions? Yes, ma'am, Ms. Matthews.
I just want to add context to this. I did read this last night and look into it a little bit further, just for the committee. There are actually 30 other states who have already passed laws very much like this as far as discrimination against disability. So South Carolina would be 31 on that list. Should we push this through today? That is something that is very commonly happening, and it is a practice that a lot of other states are picking up. So again, yeah, there are 30 other states that have already passed this, and for the purpose of what he's saying.
And we have, is it Beth Franco? You present?
Yes, good morning.
Okay, yes.
Hi. Good morning. Thank you, Representative Hart and committee members, and you'll have to excuse me. I'm battling a cold, so I'm a little hoarse in my presentation, but I wanted to thank you for this opportunity to speak this morning. My name is Beth Franco. I'm the Executive Director for Disability Rights South Carolina. Disability Rights South Carolina is the protection and advocacy organization for South Carolina. And our mission is to protect and advocate for the legal, civil, and human rights for individuals with disabilities who live in South Carolina. As a disability rights organization, we are here today in support of passage of HB 4597, and we are very grateful to have Representative Bustos advocate for this bill. Just to give you just a brief background, and there's been some discussion, currently there is a bipartisan bill that has been filed in Congress that will prohibit covered healthcare providers from discriminating against people with disabilities seeking an organ transplant because of their disability. If passed, this legislation will uphold and clarify the rights established in the American Disability Act. The National Down Syndrome Society and other national advocacy organizations are in full support of this legislation. Until this legislation is passed, the National Down Syndrome Society and other partners and advocacy groups have been working to protect people with disabilities from discrimination in organ transplants at the state level. And you are correct, there are currently 30 states that have laws in place that prohibit this discrimination. Arkansas was the most recent state to pass legislation in 2021. So why is this important? People with disabilities face widespread discrimination when seeking potentially life-saving organ transplants. Much of this discrimination happens at the point where someone is referred for evaluation by a transplant center, before they're even placed on an official transplant waiting list. To illustrate what can happen, 3-year-old Amelia Rivera of New Jersey went to the Children's Hospital of Philadelphia in critical need of a kidney transplant. Her mother had offered her own kidney to save her daughter's life. The treating specialist determined there was no medical reason not to approve the transplant. Nonetheless, Children's Hospital turned Amelia away because she had been diagnosed with a genetic condition that causes intellectual disability. In the wake of public outcry, the hospital reversed their decision and Amelia received a successful kidney transplant in July of 2013. This story illustrates why states need laws prohibiting disability-based discrimination to protect individuals with disabilities who are facing medical crisis. Although the American with Disabilities Act outlaws discrimination on the basis of disability, including discrimination by doctors, many health providers fail to recognize that this also can apply to discriminatory denials of organ transplants. This includes their obligation to make reasonable modifications, such as a modification to a policy approving people for transplant, only if they can manage post-operative care independently and without support. Therefore, DRSC, Disability Rights South Carolina, is here to support the legislation that will, 1, clarify that doctors, hospitals, transplant centers, and other health providers are prohibited from denying access to necessary organ transplants solely on the basis of a disability. 2, to require that healthcare providers consider in their evaluation the likelihood of a transplant success, the full range of supports and modifications that are available to a person with a disability within their community for post-operative care. And 3, to include a fast-track procedure for challenging discrimination to ensure that people in urgent need of an organ transplant can obtain timely resolution to their claims. Thank you for your opportunity, for the opportunity to allow me to speak today, and I am happy to answer any questions or provide any information to the committee that you need.
All right. Thank you, Ms. Franco. Thank you for participating. There are no questions.
Okay.
There's a motion and properly second that we approve H4597 to the full committee. If the clerk will call the roll.
Ms. Brawley?
Aye.
Mr. Bustos?
Aye.
Mr. Hart?
Aye.
Ms. Matthews? All right, 4-0.
H4597 has been favorably approved to the full committee, and it appears that that will conclude our hearings for today. Thank you.